I do want to make sure we go back to this this sort of issue of how you talk to your loved one, because surely if you're, paying attention for 3 days, day and night, and you're taking notes, your loved one potentially is going to be aware, depending on how you handle your surveillance. And it is a hugely embarrassing symptom. Huge.
Yes. Mm-hmm.
Many people do not want to be called out for this whatsoever.
Right.
On the other hand, many people are also highly concerned about the potential that they'll have an odor about them that's related to the incontinence. So oftentimes, if you're a caregiver, you know your loved one better than anyone. So follow your own instincts about how to handle this. But often helping your loved one from a position of, I understand this is a really difficult situation. I can't, empathize. I can't imagine what it would be like to be in your, situation. I really want to help you. We are going to need to talk to someone about this.
Right.
Can we talk about it? Can I take some notes so that we can, efficiently and respectfully get some information in a way that doesn't make you feel as uncomfortable? If your loved one knows you're going to keep the diary and you're going to help with some of the discussion, sometimes that helps your loved one feel a little more comfortable about being, having that whole episode happen. Because I've had plenty of patients who just refuse to go to the doctor to talk about it because they think they're going to have to do the talking, and explain. And as important as that is, and your loved one may in fact get asked a question about how they feel before the leaking happens or other symptoms that are associated with it. Giving your loved one that assurance that you're going to start by you, the caregiver, is going to take some, lead and ownership of helping get the conversation going with all this information. So sometimes that's enough to give your loved one the confidence that, together you can get this done. Certainly it doesn't always work. And sometimes, caregivers have to be creative about getting information to the doctor that something's happening and trusting in the doctor to bring up the topic. So there's different ways around it, but these are generally good suggestions. And I did also want to say one other thing about the idea of, don't go in and say, my loved one's having urinary incontinence. You want to, this is just a general tip. You want to avoid going in with a diagnosis. You're there with an expert who knows symptoms and what they mean. And the list of what any symptom means is long. So when, as a healthcare consumer, if we go in and say, hi, Dr. Jones, I'm having, migraine headaches. Well, Dr. Jones is a human being, and he knows you think it's a migraine, and he thinks you're a smart person, so maybe it is a migraine. And so you start talking about migraines. That headache may be nothing of a migraine. The same thing can be true of incontinence. So you report the symptoms, report what you're seeing, and have the professional help you sort through that.